Hi everybody, my name is Dr. Mike Weiner. I'm owner and chiropractor of Optimal Spine and Body located in Alpharetta, Georgia. Today I want to talk about scoliosis and really, ways to help with scoliosis and different treatment and different things you can do even at home to help. The thing about scoliosis is that in order for you really to diagnose it properly, you have to have an x-ray. If you don't have an x-ray, you really don't know for certain, 100% certainty. That's why I take x-rays. Number two is there's a lot of different reasons why you can have scoliosis. Your posture can be misaligned. Can be postural. It can be because you literally have structural abnormalities of your bones, which causes different curves and misalignments. It could be that your foundation, your sacrum is off balance. You could have a short leg, and a lot of different reasons. And in order for you to really understand what's going on with your scoliosis, you need to go to someone that actually can talk to you about this and can give you realistic expectations to get you the best type of care. Because people have scoliosis, it's really hard on them. They may be living with chronic pain. They may be living with other abnormalities too, in the sense of how the nerves in the lower part of their spine, especially if you have scoliosis in the lower part, these nerves go down the thighs, legs, and feet. You may have tightness and you may have weakness in the thighs, legs, and feet, numbness, tingling. You may have pain down the thighs, legs, and feet because that's where those nerves go to. In addition, I see a lot of people that have digestive issues because these nerves in the lower part of the spine go to large intestines. Some people have bladder issues. These nerves go to the bladder. So waking up at night to use the restroom and other types of issues, along with sexual disturbances too, in the sense of either you're having a difficulty with sexual function or you're having menstrual irregularities for women. And then in addition to that as well, a lot of women notice that maybe they aren't able to even get pregnant. So I see that a lot, especially with women that have this type of scoliosis. Let's dive into really how to correct it though. Step one, take x-rays. Step two, go to someone that's actually able to understand the x-rays, analyze each individual angle for you. And then step three is to figure out ways to correct it. Think of it like an onion. You gotta unravel each one, and then you get to really figure out what's the real cause of correcting this. So step one is you gotta see if there's a short leg, and that's how I analyze for that by taking a very specific x-ray. And what I do is I use different types of foot lifts, heel lifts, even lifts for while you're sitting to actually level out your sacrum. You see right here in this x-ray, unlevel on the left side. This is actually the left side. What I did is I analyzed. I found that 9 millimeters is what was needed to level out the sacrum. So step one accomplished. You get to wear this, and this is what you would wear to level out your body.
The x-ray on the left is before, and the x-ray on the right is with someone that's wearing a lift to correct a scoliosis.
Step two is you got to see what exercises, what type of movement to do to align this properly. And what I found through a series of different x-rays, because you have to do the exact right order, is that while wearing the foot lifts, I took an x-ray to see if bending the body to the left and then translating, moving along to the right, was able to line up the spine the best way. And this is before, and this is in that motion. You can see it's almost perfectly straight, which is amazing to see.
The x-ray on the left is before, and the x-ray on the right is when the patient does his corrective exercise.
That's the level of correction. And guess what the exercise is? You do it at home and in the office. It would be, and I'm going to do it, and you can see from the back, you would be bending on the left and then translating over to the right. You can do it this way too. Bending on the left, translate off to the right. You can do it any way, whatever the patient feels better with doing. The patient actually felt better doing it this way. Hold it there, contract the muscles. The traction holds it in that position, and then the spine can stay that way. I adjust the spine in that position by allowing the nervous system to say, okay, this is where we're going to stay, this is where we're going to hold in space, which allows the body to heal. And this patient was able to get a lot of tightness, weakness, pain symptoms went down, a lot of organs started functioning better as well, which was amazing to see, and I see it all the time. And then lastly, something you can do at home, and this is called a scoli roll, is you lay on this while in that position, while you're in there, and then you'd place it on, so this would be the left side. It would be the same thing. Place it right here, it pushes it over, so you bend over to the left side, that's how I tell the patient to do it, and then it literally will push that low back lumbar spine into the right position, and you would hold it there, and this is what you would do at home in addition to everything, exercises, traction, adjustments I do in the office. So now you're able to know what to do at home. You're able to have confidence to know, okay, this is my level of correction, and then guess what? It happens, and it's amazing to see it. And that's really the best way to correct scoliosis. And if you're not really looking at an x-ray, so just gotta be honest, it's really hard to say if you're going to be able to fully correct it to the maximal amount so that you can live the best way possible.